Hello and welcome to The Context. I'm John Barron. The United States Supreme Court has stripped Americans wanting to terminate a pregnancy of the constitutional right to do so, overturning two key cases: the 1970s abortion rights case known as Roe v. Wade and the 1990s reaffirmation of that known as Casey v. Planned Parenthood.
At the Supreme Court today, an historic upheaval. In a sweeping ruling that overturned a half a century of precedents, 5 justices ended the right of American women to choose abortion under the Constitution.
The court has handed the power to regulate abortion back to the individual American states, and dozens are already enacting laws that significantly restrict or completely prohibit someone from ending their pregnancy. Americans who have for 49 years had the constitutional right to choose whether to have a child or not now face a very different choice: carry an unwanted pregnancy to birth, travel often long distances to another state for an abortion, or arrange for abortion pills to be sent to them. And in many states, those final two options will now also be illegal. The decision sparked some celebrations and many angry protests across the United States.
Overnight, officers firing tear gas to break up a large crowd outside the Arizona state capitol. And in Iowa, police launching an investigation after a truck hit protesters at an abortion rights rally in Cedar Rapids. One person taken to the hospital.
It was in January 1973 that the US Supreme Court found the so-called Due Process Clause within the 14th Amendment of the American Constitution provided a fundamental right to privacy, which protected the right to choose whether to have an abortion.
The White House offered no comment, but President Nixon has always strongly opposed liberalized abortion. Other opponents are now talking of a constitutional amendment to reverse today's ruling.
Roe and subsequent US Supreme Court cases affirmed the right to an abortion was not unlimited, and that the rights of the fetus needed to be considered beyond the point of viability outside the womb, at around 23 weeks. And for half a century, that was largely considered settled law. States imposed some limits, regulating clinics and doctors, but beyond that, the constitutional guarantees held firm. Until now.
Today is it's not hyperbole to suggest a very solemn moment. Today, the Supreme Court of the United States expressly took away a constitutional right from the American people.
While the decision in this case, Dobbs v. Jackson Women's Health, was made by a 5-4 majority on the US Supreme Court, it was essentially a victory of the minority. 3 of those 5 Conservative votes were appointed by President Donald Trump, who was elected by the minority in 2016. Hillary Clinton won almost 3 million more votes than Trump, but lost in the states that mattered and the Electoral College. As a candidate, Trump had vowed to appoint judges who would overturn Roe.
Because I am pro-life and I will be appointing pro-life judges, I would think that that will go back to the individual states.
But I'm asking you specifically, would you like to...
If they overturned it, it'll go back to the states.
But what I'm asking you, sir, is do you want to see the court overturn? You just said you want to see the court protect the Second Amendment. Do you want to see the court overturn Roe v. Wade?
Well, if we put another 2 or perhaps 3 justices on, that's really what's going to be, that will happen.
Conservative Republicans who disliked Trump's personality still preferred a Trump-appointed Supreme Court to the sort of left-leaning court that Hillary Clinton would have created. Perhaps more than anything else, that issue won him the White House, and he has delivered. Still, a majority, 71% of Americans, including a majority of both Democrats and Republicans, say decisions about whether to have an abortion should be made by a woman and her doctor, not the government. So, despite even higher levels of support for abortion rights in Australia, could something similar happen in this country? Experts say that ending an unwanted pregnancy in Australia can already involve travelling thousands of kilometres to a clinic, difficulties in finding GPs prepared to prescribe abortion drugs, chemists willing to dispense them, and medical requirements like getting an ultrasound.
Another obstacle in the way of people in rural and regional areas getting a medical abortion is that the gestational limit is set by the TGA currently at 9 weeks, when the World Health Organization says it should be 12 weeks. And if you think about it, 9 weeks is not a huge gestational limit for abortion because you can't tell if you're pregnant till you're 4 weeks gestation. And so then you've got 5 weeks. If you can tell the earliest possible, you've got 5 weeks to make a decision and then access an abortion. And surgical abortion is just not really an option for you within your local town, so you need to travel, and the costs are really incurred by the patient.
We'll look at the history, legal reforms, ethical debates and practical limitations in a moment. But first, let's look at abortion in Australia by the numbers. Here's Madeline Morris.
The data around abortion in Australia isn't as straightforward as you might expect. Many states just don't keep track, in part because of privacy concerns. The last time peer-reviewed national data was published was back in 2005. Then it was estimated around 83,000 surgical abortions were conducted. That was before abortion drugs were available. More recent academic estimates based on hospital and day clinic data suggest under 68,000 surgical abortions were conducted in 2017-18. When they combined that with statistics for abortion drug prescriptions, they estimated there were close to 21,000 medical abortions. That put the total at around 88,000 terminations. But that was 4 or 5 years ago. To put Australia into international context, generally the richer the country, the lower the abortion rate, because there's easier access to sex education, contraception and other health services, which reduces the number of unwanted pregnancies. As a region, Australia and New Zealand's abortion rate was 15 per 1,000 women of typical childbearing age. That's the lowest in the world, according to a global health study compiled by the Lancet Medical Journal. We're just below Europe and North America, less than half the rate of Latin America, a third of the rate of Central and South Asia, with the highest abortion rates in North African and West Asian nations. So what about public opinion? Well, according to a global poll from Ipsos last year, 57% of Australians believe a woman should be able to have an abortion whenever she decides she wants one. A further 20% believe abortion should be permitted only in certain circumstances, such as when a woman has been raped. 8% say abortion should only be allowed if the mother's life is at risk, and just 3% say abortion should not be allowed under any circumstances. That puts support for abortion in Australia about 4 or 5 points behind countries like Britain, France and Germany, but around 10 points ahead of the United States, with Malaysians least likely to support abortion. Abortion in America has been a hotly contested political issue. 70% of Democrats support a woman's right to choose, compared to just 22% of Republicans. The proportion of Americans who think abortion should be legal in all or most cases is up 10 points since 2015. Those who think it should be illegal is down 4 to 37%, and there's been a significant drop in those who are unsure. How the latest Supreme Court decision affects that remains to be seen.
Up until the late 1960s, abortion was banned in Australia unless the pregnancy posed a risk to life. Legal abortions were difficult to obtain and expensive. Many doctors feared prosecution and stigma. So, for most Australians with an unwanted pregnancy, the choice was to risk an illegal backyard abortion or give birth and consider putting the child up for adoption. The contraceptive pill was made available in Australia in 1961, but initially it would only be prescribed to married women, with predictable results.
In the past year, 18,000 illegitimate babies have been born in Australia. 1 birth in 12 is illegitimate.
The social expectation generally was, if you got pregnant, you married the father, had the child, and made the best of things. And so, in the 1960s, 25% of brides were pregnant at the time of their wedding.
It's a heavy responsibility for a man to bear. Thank heaven for Mother, so calm and confident, he must hide his own misgivings.
Before Roe versus Wade in America, we had our own landmark cases. Menhennet in Victoria in 1969 found abortion was legal if the doctor thought it was necessary and proportionate. That came after a major police crackdown on abortion providers.
The current police drive against abortionists in Victoria has led to an unprecedented series of charges against Melbourne doctors and their staff, accused of performing or assisting at abortions. Charges of conspiracy have been brought against other doctors alleged to have referred patients to abortionists. The homicide squad of the CIB has raided and searched doctors' rooms.
2 years later, the Levine ruling in New South Wales went further, saying if the doctor thought there was any economic, social or medical ground or reason an abortion would avoid serious danger to the pregnant woman's life or to her physical or mental health, it would be lawful to provide an abortion. In 1970, South Australia changed its laws to protect doctors who provided abortions to preserve a woman's physical or mental health, but that still left a lot of women unable to end a pregnancy safely and legally, with around half still being turned away from hospitals.
The head of the Department of Obstetrics at the hospital, Professor Cox, says that anyone thinking that abortion is now available on demand is in for a disappointment. And this raises the question, is abortion really any easier to obtain now than before the Act was liberalised?
I don't think it is. Not in our practice at any rate.
The process of decriminalisation and legalisation of abortion in Australia picked up pace through the 1970s with the support of the women's liberation movement, and continued until only very recently.
An historic moment to overturn a 119-year-old law.
Now, abortion will be decriminalised in New South Wales.
There are still limits and differences between the states and territories. In Victoria, surgical abortion is legal to 24 weeks. After that, you need 2 doctors to approve, while in Tasmania, it's legal to 16 weeks. Then 2 doctors need to approve. The others are somewhere in between, and medical abortion using 2 prescription drugs are only available until 9 weeks after conception. All of that means the time that someone has to decide and obtain an abortion is limited. And there are also limits on where you can get one. In South Australia, the Northern Territory and most recently Tasmania, you can obtain a surgical abortion in a public hospital and it's free, covered by Medicare. But in the rest of the country, terminations are performed in private clinics.
Now there's 2 obstacles when it comes to this privatisation of abortion. The first is cost. And so there's significant out-of-pocket costs for abortion. And if you're looking at a surgical abortion at a private clinic, you're looking at upward of about $650 in upfront costs. And so this also is a bit dependent on where you live. And so if you live in Brisbane, Sydney or Melbourne, for example, that's what you'd pay. But if you live in Perth, you'd need to pay $850 for the same procedure, and the same procedure that's provided for free to people in South Australia and Northern Territory. The second thing about privatisation is these private clinics need to remain financially viable. And in order to do so, what's happened is they've really concentrated in large cities where there's more demand. And so there's very little, if any, provision of surgical abortion in regional and rural Australia.
Dr. Erica Miller has studied barriers to accessing abortion services in Australia and says since private clinics in Townsville and Rockhampton closed last year, people in those parts of Queensland have to travel up to 2,000 kilometres for an abortion, creating additional cost and stress. An alternative for them and many others is a medical rather than surgical abortion, which involves drugs that are on the pharmaceutical benefit scheme and can be prescribed by any general practitioner who registers to do so. The trouble is, most GPs are not registered.
Medical abortion, in theory, could be provided by a GP for little to no cost. And so you could go to your GP, they could bulk bill the consultation, and then you can get the drugs required for a medical abortion very cheaply. And so because it's on the PBS, and so it costs about $16 or so. And in order for that to happen, and some GPs do provide this service, the GP needs to sort of be a real advocate of abortion provision, really, because they need to bill through Medicare that doesn't really fully subsidise the time and labour involved, because there's no Medicare item specifically for medical abortion. The doctor also needs to have a relationship with a sonographer who'd also bulk bill an ultrasound, because there is a requirement in Australia that you need an ultrasound prior to a medical abortion. And interestingly, the World Health Organization have just published guidelines and they say that this ultrasound prior to medical abortion is completely unnecessary.
As a result of the regulatory and financial disincentives and the stigma still surrounding the issue, Dr. Miller says only 10% of GPs are registered to prescribe abortion drugs. And that falls to 1% of doctors in rural and regional Australia.
I am appalled, angry and heartbroken at what has taken place in our state over the past few weeks.
Barrister Rachel Wong, who is a prominent opponent of the liberalised abortion laws in New South Wales, says she would not support any push to register more GPs to provide abortion pills.
I think firstly we have to look at, whether actually more GPs want to provide this kind of service.
And while medical abortions can be prescribed by private abortion clinics, including via telehealth, that involves out-of-pocket expenses for the person seeking the termination of $400 or $500.
State governments need to compel hospitals to provide abortions, and this actually was done in Tasmania just last year. They tied hospital funding to the provision of abortion, and so now we've got 3 hospitals in Tasmania providing abortion, and that's basically because the government stepped in, and that's what governments need to do.
Rachel Wong also argues for more support for pregnant women, but she wants support to prevent abortions, not to ease access to them.
I'd like to see more flexible work and study arrangements for, pregnant women. I'd like to see, easier access to childcare, more support around that. I'd like to see, more, just a greater interrogation, by policymakers into the reasons that women seek abortions in the first place, and looking at the struggles that they're facing, so that we can actually go point by point and figure out how to address these different things.
A ring around of state and territory health ministers revealed plenty of statements of support for abortion rights, but few major initiatives to improve access. New South Wales has a pilot program aimed at improving access to affordable abortion and long-acting reversible contraception services. We then asked them how they might do that, and we've had no response. Federal Labor went to the 2019 election with a policy linking hospital funding to provision of abortion services to ensure reasonable coverage.
What we're saying is that there would be an expectation that states are offering these services in their hospitals.
That led to claims of taxpayer-funded late-term abortions and may have created a backlash in some sections of the community.
It was being manipulated and quite the wrong position being put forward.
What was that position? The wrong position being put forward?
The wrong position being suggesting that in some cases that we were advocating for abortion in the 3rd trimester. It's just wrong. It wasn't about advocacy, it was providing support for people who needed it.
Perhaps because of that, it was not announced as a policy at all in the last campaign. We asked the new Federal Health Minister Mark Butler what their policy is now. His spokesperson told us they are committed to protecting and promoting reproductive rights, and they regard that right as well settled, but said nothing about public hospitals being a greater part of that system. Although Rachel Wong isn't convinced that abortion can still be considered a right, much less a settled one.
Yes, I think that question is exactly the question that is being considered in terms of, the reversal of Roe, whether there is this unfettered right to abortion on demand at any stage for any reason.
1973, the year Roe versus Wade was decided in America, also saw heated arguments on the streets of Melbourne as anti-abortion protesters clashed with supporters of law reform in Victoria.
We are all women. Don't try and make artificial divisions between women. We need unity.
We kill them before they get here. That's the modern science for it.
But he's your child. You haven't seen it. You haven't seen it. You're providing for it.
Who wants to go on having kids every bloody year? Well, okay. All right, so I will. Yeah, so I will, but it's none of your bloody business. But you're trying to force people, and that is. We're not forcing anyone. Oh, yes, you are.
But that bill is
trying to stop everybody from having an abortion. If you'd been raped, would you say, all right, I'm pregnant, I'd be delighted to go on with your pregnancy?
Margot Somerville is an internationally renowned medical bioethicist. She was based in Canada for 4 decades and is now Professor of Bioethics at the University of Notre Dame in Sydney. She argues against abortion on various grounds, including ethical ones, and has raised concerns about abortion being used for sex selection overseas and in Australia. Professor, welcome to The Context.
Thank you. It's lovely to be here.
What impact do you think the overturning of Roe might have on the discussion around abortion in Australia?
Well, it's got no immediate legal relevance, but because abortion is always an ethical issue, and because abortion is a public bioethics issue, it will have an impact in how we see the ethics of abortion, I think, because it will open up a much wider range of interventions to regulate abortion, which will go from very restrictive to very liberal, probably. So, and that probably will have some impact in Australia.
What do you mean by the word ethical in relation to abortion, and who determines what is ethical?
What ethics is, it is applied morality, and where I mostly work in it is in the context of healthcare and medicine, and it's very relevant there. It affects almost everything that healthcare professionals do. And so consequently, abortion falls into that context, and it raises a whole spectrum of issues, ranging from what is ethically required to respect the woman, what is ethically required to take into consideration the claims of an unborn child, what is ethically required when you've got healthcare professionals who've got conscientious objection to some of the procedures that can be done in medicine, and applied ethics, and the other word for that now which has come into use is bioethics, is trying to work out how that those moral principles and rules and even intuitions and perceptions should be applied in a given situation.
Professor, polls do show 75% of Australians support access to abortion under any or some circumstances. It is now legal in all Australian states to obtain an abortion prior to different cut-off points. So does being legal and broadly accepted mean it does meet a community ethical standard?
No, what it means is that just because something's legal doesn't mean that it's ethical, but the fact that it's legal means you can do it, whether or not it's ethical. Most people would agree, even like, for example, pro-life people, a lot of them would agree that if the woman's life was in danger or there was a very serious threat to her health, they themselves would probably not have an abortion because they think it's unethical, but they do think that the woman then should have the right to decide whether or not she has an abortion. Similarly, at the pro-choice end of the abortion spectrum, even though those people are very much that it's the woman's body, it's her choice, she should be able to decide in a very wide range of circumstances whether or not she wants to have an abortion, they will still say, but we don't agree that abortion should be available for sex selection abortion.
Finally, Professor, let me turn the issue around just a bit. Is it ethical to require a woman to travel thousands of kilometres to have a legal termination, costing many hundreds of dollars, that another woman can have for free because of where she lives? Do you accept those sort of ethical concerns?
I take them into consideration because that's what we all have to do. You're talking about healthcare resources and access to them and allocation of them. And you also have to take into account that many healthcare resources are not provided in, for example, rural settings.
Professor Margot Somerville, good to talk to you.
You too, John. Very nice to have met you.
So, some who oppose abortions in all or most circumstances are hoping the overturning of Roe will see a significant shift in Australian attitudes, a reconsideration of the ethics and the rights of the fetus. Dr. Kathleen McNamee is the Medical Director of Sexual Health Victoria and Adjunct Senior Lecturer in Obstetrics and Gynecology at Monash University. She's concerned about what that could all mean for those wanting to access abortion services in this country. Kathleen McNamee, welcome to The Context.
Thanks, John.
Are you concerned that anti-abortion groups will be emboldened by Roe being overturned in the United States?
I think that's the main concern. It gives them a little bit more oxygen and a little bit of a more platform to stand on and put forward their thoughts.
Even if we don't see legal rollbacks here, could we see measures to improve access and affordability be limited as a result?
It's always a concern. I mean, the provision of abortion across Australia is actually really quite patchy. It's really good in some places and it's almost non-existent in other places. So perhaps if it's an area where the person is anti-choice or maybe not even anti-choice but reluctant to provide abortions, it just might give them a little bit more sort of impetus not to provide the service.
Why have most state governments in this country been so keen to leave surgical abortions up to private clinics? Is that all about perceived stigma?
I think it's partially stigma. I think, what I hear from people in rural areas is they don't really want to be seen as the abortion doctor. And I suppose once one person sort of puts their hands up, other people see that it's actually it's a good form of care that you can give to people, it sounds sort of weird, but people actually get a lot of pride in their service then, and that encourages other people, and we've really seen that happen. We also have a Champions Network in Victoria that's run through the Women's Hospital, and they really support local provision in rural areas of abortion. So I think it's sort of got that sort of spreading out effect, which I hope will really improve a lot with time.
I wonder, as a former GP yourself, do you understand why so many of your colleagues don't want to become providers of abortion drugs?
Look, it's really hard to say. I suppose even though generally there's good public support for abortion, there still is a little bit of distaste about seeing it as just a routine part of healthcare, there's often a push for putting things like counselling in there. Like in Western Australia, you actually have to see two doctors to have an abortion. You can't just go in and get a medical abortion as you can in Victoria. I think it's maybe a bit of a combination of both, really.
In your view, are we doing enough to prevent unwanted pregnancies in the first place?
Look, I think we can always do more, and that's the other side of our business is long-acting reversible contraception. We really encourage that, and we're training a lot of GPs to, insert IUDs and get the provision out into the community. But those choices aren't for everybody, and no matter what we do, there are always going to be unintended pregnancies. And I suppose the other thing is education from an early age, and educating people about the choice that they have.
And if this topic has raised any issues for you, please call Lifeline on 13 11 14 or Beyond Blue on 1300 22 4636. And that's all for The Context this week. Next time, are we seeing the end of the great Australian dream of home ownership? I'm John Barron. See you then.